All right, good afternoon. Thank you for coming. I've come from Shrewsbury this morning. Shrewsbury to some other people. That's a little county town in the county of Shropshire. Turn left at Birmingham and go 50 miles if you want to know where that is. And I'm going to talk to you about sedentary behavior. And I'm very grateful to the conference and specifically Cormac from Ferrell and Louise from Linux for organizing my trip to come and visit you today and to talk to you about the ills of sitting. I will sort of interact with you in a moment on that specific factor. Just to say that I work independently as in these matters. I don't have any interests in commercial interests of any products related to my talk, but my only interest is to help people sit less and move more. And you may or may not know about your own Healthy Ireland surveys on physical activity and health, and there has been one each year in 2016, 2017. And similar to the World Health Organization's global strategy on diet, physical activity and health, and the UK or Public Health England's own physical activity strategy, all of them now mention the concept of sedentary behavior. And what sedentary behavior simply is the amount of time that you spend sitting. And it is now identified as what we call an independent risk factor. So those of you who are exercisers and very proud of the fact that you do your regular exercising, you may be losing much of the benefit if you spend the rest of your time sitting, and I think that would be the sort of focus of my presentation in relation to that. So, as I said, I come from Shrewsbury, and that's about 250 km from London, and it is historically the center of the universe for sport and physical activity. And you're probably thinking he's joking, but it literally is. So here is Ironbridge in Telford, near Telford in Shropshire, near Shrewsbury, the birthplace of the Industrial Revolution. And there is a bridge across the river, I think, somewhere in Dublin that looks similar to that. And that's where they got the design from. That's Abraham Darby's first iron bridge that he designed as part of the Industrial Revolution. And since that point, we have taken out about 1,000 calories a day of energy expenditure from our lives. Prior to that, and back to the entire history of man, so we got millions of years of man and his hunter-gatherer status, but only in the last few hundred years have we actually reversed the whole use of our body. We are designed as hunters and gatherers. Our bodies are designed to store energy for that purpose, and that's why we can accumulate weight very easily. The other famous thing goes back to your last photograph, Charles Darwin. He was born and educated in Shrewsbury. And the concept of the survival of the fittest really is absolutely true. Data collected over the past 5 decades has shown that there is a direct relationship between people's fitness and how long they live. And in fact, if you take the least fit and get them a little bit fitter, that has the greatest impact on health. So if you think about your staff, do not worry about those people who are already active. Worry about those people who are very, very inactive. And any small amount of activity could make a huge impact on their individual health, but probably on the health and well-being and performance of your staff as well. I said Shropshire is the home of sport, and it's the home of the modern Olympics. And this is Dr. William Penny Brooks, one of the first sport and exercise medicine doctors, because he started up the modern Olympics. But he wrote to Parliament in 1890 saying that people should do half an hour of exercise every day. It took till 1996 before any of the governments around the world actually said anything like that. So a doctor in this little place called Much Wenlock. So this is Shrewsbury, and home to our new university centre, and specifically my little centre for active living. where we've been doing some research, and one of the areas that we do research on is looking at the energy costs and changes in your blood glucose and your energy expenditure with standing desks. But the important bit of these graphs is that those lines that are going down is energy expenditure related to various industries and time spent. So we can see that the ones that are going up are time spent in work that's related to very little inactivity or in fact sitting down. So whether you're in the United States, whether you're in India, anywhere, the world over, if we're seeing prosperity and development, what we're actually doing with that is reducing people's energy expenditure. And the biggest loss of energy expenditure in people's lives is at work. So the World Health Organization has set one of its main targets for preventing what we call non-communicable diseases, heart disease, diabetes, etc., by reducing the amount of physical inactivity that people have in their lives. So it's up there along with salt, tobacco, blood pressure, diabetes. Physical inactivity is one of those 9 key risks that are being identified. So the World Health Organization, as with your Irish government, as with most governments, saying that people should do 150 minutes of moderate intensity activity each week. But if we actually look what proportion that is of your waking hours, of your 10,000 minutes per week, so you're alive 10,000 minutes per week, you spend a third of that asleep. So 3,000 of your 10,000 minutes are spent asleep. The other 6,500 minutes you are awake, and if you did your exercise, as the government recommends, that only represents 2.5% of your waking hours. That's if you're good and did your exercise. Now, we know most of the population aren't good and don't do enough exercise. So the question is, even in the exercises, what are you doing with your muscles, the other 97.5% of your waking hours? Well, you're doing this, sitting down. So, is anybody wanting to stand up? Because you've been sitting there for at least 40 minutes, if you're here for previous presentation. Nobody wants to stand up. How come I couldn't get anybody to stand up? How come you didn't stand up? I invited you to. I'm going to give you some evidence. Pardon? Too lazy. Why didn't you stand up? Now, I got one person to stand up. You want to stand up on the end there? Anybody else now? If I get a third person in, behavior will change. There we go. It's happened, right? Now, do you see, changing people's behavior requires some leaders. This lady on the end, can you stand up or not? There you go. Fine. And somebody might follow you, right? I've got to stand here for 20 minutes to talk. Why can't you? Yeah? Okay. Now, I challenge you to stay there for the rest of the presentation. I'll get you a free cupcake, because I promised the woman at the desk across there I'd come for a cupcake to reward myself after standing talking to you. So we have this challenge, actually, and our biggest challenge in physical activity is sat down now. Right, okay, he stood. So we have much more evidence emerging about the ills of sitting too long, and that is becoming an area of research. And we call this light activity. Now, the picture here is my bank in Vancouver, because I'm Canadian by birth. And whenever I go into my bank in England, I'm now only starting to see the workers on their feet as opposed to sitting down all day. In the middle is a standing meeting, because we know they're shorter and much more productive now. And how many people have their own bin at their desk? Just a small way to increase activity in the office. Ban the bin, yes, and create some social interaction. How many people have sent an internal email that they didn't need to send, which it might be more productive to actually see the person, especially when they're emotionally charged? Okay, it's nothing new. Who's this chap here? He's written a lot of books. It's Ernest Hemingway. Wrote most of his books standing up. And this is pictures from 1940s. As an office worker's accountancy office, that's a picture in Life magazine of people doing work standing up. Think of the monks writing all the scripts in the Bibles in the way in the back. They all used to stand up writing those as well. So sitting is a modern behavior, and we've associated the chair with people's positions in organizations. Look at the size of somebody's chair. That tells you about their position. I'm a professor, and I'm given a chair. It was a bit ironic that I got a professorship based on the research I did on standing up. Anyways, so most of our evidence from physical activity and sports science actually comes from occupational health, because the first studies to show the prevalence of people getting heart disease was in occupations that had standing versus sitting. Bus drivers versus bus conductors in London. Office workers versus the dock workers in San Francisco. The two landmark studies, occupational health settings, where that's where we got the science behind exercise. Postal workers in the office, postal workers out delivering. Wherever you find these comparisons, they've done research on them and shown that those people who have the sitting jobs live shorter lives and have more disease. And we can see the black line there is the acceleration in the past 20 years in occupations of people sitting. And that's the same for, this is the United States. If you look at Brazil, it has the same black line. You look at China, it has the same black line. If you look at India, it has the same black line. So remember this, only 150 minutes is only 2.5% of your waking hours. And this large study done in Canada specifically looked at jobs where people sat compared to people standing, and they broke them down into different categories. And these are what are called survival curves. This is what pharmaceuticals always do when they have a drug that they find. They look at survival curves. Now, the best survival is in people who have jobs where they're on their feet all day, and the worst survivors are the people who have occupations where they're sitting down all day. And those lines follow in the perfect categories. They broke them down to almost all the time at work, 3/4 of the time, half time, quarter time at work, and almost no time at work on their feet. And this is their death rates in years following up. So there's some association between people who spend a lot of time sitting and dying early. Now, people who die early, they also have disease, and leading up to their death, they're probably less productive in life because they're ill. So here's a chap. He rides his bike to work every day and back again. So he says, I've done my 150 minutes. I can sit down at my desk and work the rest of the day. Or maybe you go to the gym for your half an hour a few times a week, and you get your 150 minutes in a week. But does that cover the ills of all the sitting that people do? So here we have a couple of people, and this might be you, saying, well, what is your activity category? So I'd like to categorize you now into one of 4 areas. You can do it yourself. I'm not going to ask you, but you can just in your own mind. Are you the full couch potato? Do you have low levels of what we call light physical activity, or do you spend a lot of time sitting and do you not do very much exercise? That's the absolute couch potato. We have light movers. Those are the people who say they're on their feet all day and I don't have time to exercise, but they're better off than the previous group. So they do some activity, but it's of a light nature, but they're on their feet all day. Then we have the exercising couch potato. That's the person with the gym membership who's really proud of themselves, but they spend a lot of money on getting fit, but they sit down the rest of the day. So that's the exercising couch potato. How many of those do you know? And then there's the busy bees who top of the class. They do lots of activity, exercise, and they don't spend very much time sitting. So just think, which one are you? Which category do you fit? And if you can move up the scale, there is a health gain with each change in that. So all I'm interested in is moving people on from one category to the next. Now, I know most of the population are in the first 2 categories. So if I can move them on a little bit to the next category, there's going to be some health benefit. So if we look at that, this data on 2,000 people surveyed and looking at people's sitting time, half of the people who spend a lot of time sitting are actually exercisers. There aren't very many people in the light mover group. So what we need to do is shift more people at least into the light mover group, especially if they're not exercisers. Now this is I'm going to make this a bit simpler because I took a long time to try and understand it. So this is an article which was published in a journal called The Lancet, the leading medical journal in the world, and it was on a study done on 1 million people. So it's not a small study, and taking data from their sitting time, their exercise time, and their risk of dying early. So what they've done is they've categorized people into those two elements. How much time you spend in a day sitting, and what your exercise category is. So if you were the busy bee, you will do more than 6 hours of exercise per week, and you'll spend less than 4 hours sitting, and so on. So if we look at that first category, that if you are doing 6 hours of exercise in a week, that's an hour a day pretty much. If you are doing that, you can pretty much afford sitting for lots. Okay, I'll grant it, you can have that, but I don't know many people in that category. Then there's people in the category who do 5 to 6 hours of exercise a week. That's still a lot. That's 5 one-hour sessions a week. But they are starting to show some risk by sitting too much. So if you spend more than 8 hours, you've increased your risk of dying prematurely by 10%. Now, this is the World Health Organization's recommendations for exercise, that if you do 2.5 hours per week, but if you sit too much, can you start to see that the risks start going up significantly of developing disease and dying prematurely? And then if you were like most people in most Western countries, you probably do less than an hour of exercise a week, and you probably sit more than 6 hours a week. And you can see that your risk goes up hugely. So unless you're actually in this category of doing 6 hours a week, everybody else needs to sit less. So if you're one of these two people, they both get their 150 minutes per week of activity. But they're doing something obvious in their behavior that is counteracting against that. So spending time sitting is a bit like eating unhealthily or smoking. So to move on to the next things is, what have we done in the workplace to assess this, and what are we doing to change people's behaviors? So the obvious things are there's simulated nudges. People might have a monitor on their wrist that vibrates every hour if they've been sitting too much. It gives them a nudge, or you might have something on your computer, or you might take the bin and not have one at your desk. What we call these nudges. People are now having standing meetings because they don't. If you ever have a meeting and you want it not to last too long, especially if you're having a meeting with somebody you don't like, don't sit down with them. Stand up. It'll get done much more quickly. It's great. It works really well with my university students. They come into my office. I don't offer them a chair. We stand there. We get the business done, and it's gone. Because as soon as somebody is standing, that means that they're ready to go. Where if you sit down, unless it's a problem, then you actually, it's like rubbish. It collects more rubbish. So sitting it has so many different social connotations to it that can be quite negative. Sit-stand workstations are a key area now that's being used in office spaces, of which where I've done some work in. So that is the first step in getting people on their feet, because you can't be more active unless you're on your feet. And then there's exercising workstations. So one of the research projects that I'm involved in is called the RESIT study, and it's about having meetings in office spaces, and people are now congregated in various spaces. So again, the provision of chairs is an unhealthy thing. So imagine this room here, if there was only half of the room had chairs and half of it didn't. You'd be forced to stand. But is there anything bad about that? Maybe chairs and elevators and escalators should be for disabled, injured people, and the rest of us should use the stairs. Okay, so think about things like that. In terms of health, there's both the physical effects and some of the psychosocial things, the organizational performance factors. So both of these are being studied a lot now in various bits of research around the world. And there's obviously the change in mechanization of how we work and what we work with that's creating unhealthy positions. For example, the tablet, the laptop has completely changed our working positions, and now we have the mobile phone where we stand in a very bad posture to read. So all of these things are eventually going to rear their heads in terms of health issues that could reduce people's productivity. So the work that we've done is part of about 10 or 12 different large research projects looking at the cardiovascular and the metabolic, that's diabetes and energy expenditure elements of health. And if you think about your blood vessels, how many people think their blood pressure has been raised at work with a stressful telephone call or, okay? Now, if you've got healthy blood vessels, when your blood pressure goes up, we want those blood vessels to dilate so that the pressure doesn't go up too much. If you've got stiff, unhealthy blood vessels, then your blood pressure will go up and stay up at unhealthy levels. The fitter, healthier person has more elasticated blood vessels, so when the pressure goes up, they relax, and that's why when people are exercising and fitter, they respond. Now, this is what's an acute bout of doing some standing work at a standing desk has shown, is that when your stress levels go up, your blood pressure will automatically decrease much more quickly and not respond so unfavorably to that stressful situation. So in these studies, they put the blood vessels under stress and then measure how quickly they respond. And when people have done some standing work in a day, they found that just that one day of work makes the blood vessels much more responsive at opening up and responding to changes in pressure. This is changes in blood glucose from sitting, standing, light intensity physical activity and moderate intensity physical activity. This is glucose and this is insulin. Any rise in glucose, any rise in insulin is not a good thing. So we can see there's a sliding scale. So standing is the first element of starting to bring your blood glucose down after you've eaten something. So how many people have just had some lunch? Because I just had some about half an hour ago. And you were standing for half an hour. And so your blood glucose won't have risen so much. So in this study that we did, which was featured on Trust Me, I'm a Doctor on the BBC, we took a group of real estate workers in their offices, and the yellow line is the change in blood glucose after lunch on the day that they were standing, doing standing desk work, and the blue line is their blood glucose levels in the afternoon after lunch on the day that they sat. And you can see there's quite a difference in the changes in their blood glucose responses. So people who have repeated bouts of raised blood glucose are those people that sometimes develop diabetes. We've looked at a group of call center workers at Virgin Media and looked at their behavior, and we actually gave them standing desks in half of them for 6 months, and the other half sat, and then we swapped them over. The other half got standing desks and took them away, and we looked at their overall weekday sitting time. But what was quite interesting is once we put the desks into the office environment, even the people who didn't have a desk increased the time that they spent standing up at work, or spending more time on their feet at work and at home. It just made people more conscious. So our control group actually benefited from that. And then when we gave the controlled group the desk, then they maintained their sitting, reduction in sitting time, where the actual initial group, they returned back to their normal behavior of sitting too much. So it's not all good news, as we always have to discover in science, that people tend to modify their behaviors. So if you give them a standing desk at work, or you do activities around the office to make them stand more at work, sometimes they'll do less at home, and it sometimes balances out. So we have to make sure when we promote activity, we promote it globally in everybody's life. So, in terms of health and safety and health promotion, all of these things, is that it is always important to focus on all elements, because some people think, well, I'm doing more activity, therefore I can have the bag of crisps or the extra muffin or whatever. So people tend to counterbalance sometimes one healthy behavior for another unhealthy behavior. So finally, to get to the end of this, a group of us around the world produced these guidance, the first guidance ever for reducing sedentary behavior in office workers, and we recommended that people try and be on their feet for at least 2 hours of their day, and ideally 4, as in terms of meeting the scientific sort of benefits. So just to summarize, we've had this evolution of physical activity behavior change that's taken us through the evolution of man, and where we've now evolved work that most people are sitting down. So really the next step behaviorally is to get people active, is actually get them on their feet. How many people drove a car today? Anybody drive a car today? Did you put it in reverse? Have you ever tried going from reverse into third gear? what happens? Pardon? If you go from reverse into third gear, what happens to the car? Cuts out, it stalls. Well, most people in their behavior are in this position here in reverse, sitting a lot, and they often then join a gym or a sports club, and they try and go from reverse to third in terms of their behavior. And yet there's two steps in between. One is spending more time on your feet, and once you're on your feet, moving about a bit. And if we take people through this behavioral path, we might be more likely to maintain people's health behaviors in terms of being physically active. And so really think of your life in terms of if you spend a lot of time in reverse, then try and spend a bit more time in first gear. If you're in first gear a bit, then try and move to second gear, etc. So when we're making health promotion in our workplaces, we have to just do an evaluation of where people are on this continuum in order to make decisions about what behavior and how their behavior should change. So here's Ernest Hemingway, writing in travel, broaden your ass, if not your mind, and I like to write standing up. Thank you very much.